Dr. G, do you think parents should take control in deciding when to take that pass, when to take a mental health day?
This is really useful for us to be clear. Kids are in charge of expressing their emotions. We may not always love how they express it, but I've said when we've talked before that our kids' feelings are theirs and their behavior is ours. So we have to listen really well when they're expressing their feelings, keeping in mind that sometimes with kids, communication sometimes comes through behavior. And when they express their feelings, when they say, I'm having a hard time, or I don't feel like it, or it's hard, or I'm unhappy, that's theirs. But it is, of course, our job to say what they can do. This is not a situation in which we give the kids total control and say, you have the reins, it's up to you what you do with this. But it is an opportunity for us to help them learn. Because as soon as our kids are out of the house, it's going to be up to them whether they go to class or not, or whether they show up for work or not.
That's right.
If they don't have some skills and some strategies to navigate the times where they don't feel like it and figure out the difference between I don't feel like it and I'm not well today, if we've never worked through that with them and had them mess it up or us get it wrong sometimes, when the stakes are much higher as they're adults, it will be scarier for them and for us.
All right, Dr. Muradian, what do you say to critics that say that this is coddling the child?
Yes. Oh gosh. So I want to go back to the P. The P really struck me. I mean, I'm a mom of 3, so certainly we've all experienced, and we've seen it also with our clients. The PE thing is the best, because I think that in terms of, and this is perfect response for critics is, when your child will say something like, well, I don't want to go to PE today. I just don't want to go to school today. And it's PE day. And they'll say, well, my stomach's hurting, or I'm just not feeling up to it. And again, it goes back to communicating. It goes back to really dissecting what that means for them. And the coddling part, what could be coddling, which is increasing our communication, because kids nowadays will tell you, one thing, they'll say, everything is at our fingertips. I have teens telling me this all the time. We have everything that we need. We know everything. We think we know better than you do as parents. And so there is this heightened response, and I think that's when conflict happens. And so when you step back as a parent and you can kind of put the parameters, put the boundaries, and explain, coddling is not giving in, like, you were mentioning. The coddling is when you're letting them take control of that situation, saying, oh, okay, this is like the second time this month you've kind of not gone to pee. Okay, no problem. And that's dismissing it. It's not actually facing it.
Gotcha. Well, listen, great insight, Dr. Muradian. And I think Dr. G and I agree with you. There are some definite pros here that we have to have the ability to help our kids that are dealing with difficult mental health issues. So thanks so much for joining us, Dr. Muradian.